Okay, are we there yet? Angelica, Annalise? Is it? Yes? Okay.
Yes.
Oh, okay. Thank you very much for your patience. I'm sorry about that. Every time I think I know how to do it, but every time something new comes up. All right. Okay, so let me start again. Hello, everybody. Good afternoon, Mexico. Good evening in the UK. I'm very pleased to present today a very special guest, Dr. Maria Cristina Rosas. And she is going to be introduced by another very special guest, Rodrigo Melendres from the Mexican Embassy. We are going to keep our microphones and our cameras off during the presentation, and there will be some room for questions at the end, which you may make through the chat box or live if you are in the Zoom room. And if you are watching us on Facebook Live, you can also make questions via the chat option on Facebook. Welcome, everybody. And I leave the floor to you, Rodrigo.
Thank you, Annalena. Good evening, everyone. I'm delighted to be part of this event organized by UNAM, United Kingdom Center for Mexican Studies, in which we are all very pleased to be joined by Dr. Cristina Rosas. As Annalena mentioned, my name is Rodrigo Melendres, and I'm head of cooperation and education at the Mexican Embassy in the United Kingdom. First of all, thank you for inviting me and for the opportunity to be here. As an alumnus to the National University, it's a great honor to introduce Professor Rosas. I am particularly pleased that my alma mater, UNAM, is organizing this talk with such a renowned specialist, which occurs as we approach a pivotal moment in the development of a vaccine against COVID-19, which will drive far-reaching effects at a global scale for the foreseeable future. As we all know, clinical trials have resumed for the vaccine developed by the University of Oxford and the British pharmaceutical industry after a routine voluntary pause occurred to allow for independent researchers to verify scientific data following a serious health incident involving one of the study participants in September. The US Johnson&Johnson vaccine is set for the same direction, and it is expected that trials will restart soon. On the other hand, a couple of vaccines have been granted regulatory approval by the Russian government without entering phase 3 clinical trials. Critically, a number of vaccine candidates will be entering further stages of trial phases, while phase 3 clinical trials for COVID-leading vaccines will be up and running before the end of this winter. So what are the risks? What are the potential effects of this development beyond public health? Well, to answer these questions, we have UNAM academic and internationalist Cristina Rosas. Let me present you all with her very impressive resume. She is a full-time professor and researcher at the Faculty of Political and Social Sciences of the National Autonomous University of Mexico. She is a member of the National Researchers System. For almost 3 decades, she has been a professor at the Center for Naval Higher Studies at the Ministry of the Navy in Mexico. She also heads the Olof Palme Center for Analysis and Research on Peace, Security and Development, and directed the Mexican Association for Canadian Studies between 1999 and the year 2000. Cristina has a number of awards to her name, including the prestigious Jesus Silva Herzog Prize Award for her contributions to research and international economics. She was also the recipient of a public recognition award for her academic lifetime achievement by all the universities based in Mendoza, Argentina in 2018. As to the public sector, Cristina has served as a consultant to the Mexican Ministry of Foreign Affairs and for the Japanese, Canadian, and Swedish governments, as well as international organizations based in Geneva on trade negotiations. She has authored around 100 books on international trade and security. Most recently, She edited a volume on the North American Free Trade Agreement 2.0 in preparation for the USMCA negotiations, and has an analysis on the space security published by UNAM and the Mexican and Australian space agencies. She studied in Sweden and Mexico and has been awarded 2 doctorates in international relations and Latin American studies. As a commentator on international politics and economic issues in the press, she has made several appearances on national and international media networks. Finally, on a more relaxed note, or at least academic one, she's a lifelong fan of The Simpsons, pastime I think we both agree, and maybe some other members of the audience, and enjoys studying beat culture and playing the piano. Well, I don't play the piano, so that I don't share with her. Without further ado, over to you, Professor Rosas.
Thank you very much. Good afternoon, Mexico. Good evening, UK. I'm delighted to be here. I want to thank Ana Elena and Rodrigo and UNAM UK for having me here so that we can talk about a very important issue that has captured the attention of audiences all over the world. I should probably add to what Rodrigo said, that despite that my background is in international relations and international security, I've been dealing with health issues for a while. I have an specialization on epidemiology at the Faculty of Medicine at UNAM, and I have also attended a specialization on global health diplomacy in Geneva. So I'm interested since a long time ago on health issues. And that said, let me share with you some slides that I believe are going to make this presentation more hopefully interesting to you all. Let me see if we can start. So I have divided my presentation into the following issues. First, of course, I have to say a few words about the case for vaccination. Why is that vaccines are important? What are their accomplishments? And also, if we speak about vaccination, we need to talk about anti-vaccination, because anti-vaccination exists because we have vaccination. That said, later I will discuss a bit what Rodrigo was mentioning, that we have already a lot of effort put by governments and pharmaceutical companies in developing a vaccine or a series of vaccines against COVID-19. And the question remains about having this vaccine and if people could get it. Surprisingly, there are answers that suggest most people won't get the vaccine, even if it is developed by the end of this year. We will get back to that in a minute. And I'm going to talk about also about the relevance of health literacy. That's an issue that's becoming more relevant at this time because we are so exposed to infodemic, and a lot of information that is not reliable, that probably that is causing, a misunderstanding about vaccination and about the sense of the medical sciences as a whole. And I will finish with some remarks that will probably leave the floor for questions and comments from the audience. Well, speaking about the case for vaccination, you can see Bart Simpson here suffering from vaccination. Well, vaccines are important for several reasons. The World Health Organization states that they prevent between 2 and 3 million childhood deaths every year, and they could prevent 2 million more. Unfortunately, many parents are reluctant these days to get vaccination for their children, which is why we are seeing the resurgence of a number of illnesses, such as measles. Vaccines are also important because they keep diseases under control and may even eradicate them. In the history of humanity, only one disease has been completely eradicated. It is the case of smallpox. I will go back to that in a minute. Vaccines also have contributed to growth in life expectancy and protect the health of societies in the entire world. Now, vaccines take a lot of time to develop, and I would like to make this clear because today we are hearing a lot about having a vaccine against COVID-19 in a short period of time, but normally vaccines take a lot of time because they need to go through a different process to different stages so that they are reliable and safe for people, and just to guarantee that they don't have side effects that happen to be worse than the diseases they are intended to fight. Vaccines, of course, require medical research and development, and political will. I will tell you why I believe political will is critical in the development of vaccines. But before that, let me tell you that vaccines depend more and more on health literacy in societies. If there's a push coming from the society to have a vaccine, that could be in favor of the development of vaccines. Speaking about political will, there is a number of diseases that have stayed with us for a long time. Let me tell you a bit about Chagas, the Chagas disease. The Chagas disease is a disease that is endemic, especially in the Americas, in Mexico, in South America, and now is becoming a serious health problem in the United States and other developed countries. But Chagas has been with us for a long time. The first president of Mexico, Guadalupe Victoria, died because of Chagas. Charles Darwin, do you remember that man that wrote The Origin of the Species? He died because of Chagas. He visited this continent, the Americas, and he got the illness and he died because of that. So that tells you that this is a disease that has been with us for a long time, and it is called by the World Health Organization a neglected disease. That is to mean that despite being for so long with us, there is no treatment, a proper treatment to fight the disease. And that has to do with the fact that most of the people that is affected by Chagas, that is produced by a bug that is called a kissing bug. You can see the bug right here on the transparency. That bug bites the people, and the urine and of this bug enters the human body, and after a 15-year period, more or less, people die. Normally they have a cardiac arrest caused by the bug, the sons and daughters of the bug in the human body. And well, the fact that we don't have a vaccine or a reliable treatment for Chagas has to do with the fact that most people affected by this disease are middle or low income countries, and pharmaceutical companies don't want to invest on that. So this is an issue I'm mentioning because, COVID, of course, is a different disease that is affecting the whole world, developed and underdeveloped countries. And of course, there's a lot of interest, commercial interest, but also medical interest in having a vaccine. But it's not the case of Chagas. So there's a number of diseases that are neglected, that are forgotten by the situation that we are seeing at this time. Now, speaking about available vaccines, according to the World Health Organization, we have vaccines only for 26 diseases. Only 26. Of course, there are more than 26 diseases in the world, but the world has been able to produce, humanity has been able to produce so far only 26 vaccines. We have vaccines for cholera, dengue, diphtheria, different strains of hepatitis. We have a vaccine for influenza, for Japanese encephalitis, for rabies. Rabies is important because rabies is a disease that has a lethality rate close to 100. That means that if somebody gets rabies, it may probably die. So SARS-CoV-2, COVID-19 doesn't have that lethality rate. It has a lethality rate between 2 and 3%. But rabies, tetanus, Ebola, some strains of Ebola have a lethality rate between 50 and 90%. So to have vaccination against so lethal diseases is of critical importance. But as you can see, we have vaccines only for a few diseases, and there's also what it is called pipeline vaccines. That is vaccines in development for certain diseases, such as Chagas. There is a treatment for Chagas that is worse than the disease. I have known a couple of people who got the Chagas disease, and they feel so bad with the treatment that they decided to stop it. So there is a vaccine under development for Chagas, for chikungunya, for dengue, for AIDS. We don't have a vaccine for AIDS. We have treatments, but we don't have a vaccine. So these are the diseases for which vaccines are being developed, but this is only a bunch of the existing diseases all over the world. We don't have a vaccine for Ebola, for instance. So this is of critical importance. And let me tell you a few words about the smallpox, the only disease that has been eradicated in the history of the world. Smallpox is one of the oldest known human diseases. There is evidence that it existed over 3,000 years ago in Egypt. During the 18th century, smallpox killed every 7th child born in Russia. Every 7, and every 10th child born in France and Sweden. So it was a very lethal disease. You can see in this picture a boy that got the vaccine, as opposed to a boy that didn't get the vaccine, and you can see how terrible is this disease. Edward Jenner, the English physician, you have a very prominent institute in England on behalf of this physician. He carried out experiments to control the disease. He realized that many of his patients who had been exposed to cowpox, the much milder but related disease, were immune to smallpox. So as we know, he inoculated an 8-year-old farm boy, we can see that in this picture, with cowpox virus, and after observing the reaction, re-inoculated him with a smallpox virus. So this is of critical relevance because Jenner invented the concept of vaccine. So thanks to Jenner, we have vaccines. And that procedure he used helped to fight the disease. Until today, smallpox is the only human disease, as I explained before, that has been successfully eradicated. And the history of the eradication of smallpox is very relevant for several reasons. First, it was a disease that was endemic and caused high mortality rates all over the world. Second, was crucial to advances in the field of immunology, as a smallpox vaccine was the first successful vaccine to ever be invented. And in 1980, the World Health Organization, that was 40 years ago, declared smallpox is dead. Now, as I explained at the beginning of my presentation, if we have vaccines, that is also the cure for the anti-vaccination movement, because the smallpox vaccine happened to be less safe than other vaccines routinely used today. I got the vaccine. Currently, people do not get vaccination against smallpox because, as I mentioned, it has been officially eradicated. But I was born in 1965, and I remember my mother took me to the doctor and I got the vaccine. And I remember mild reactions. I remember having fever, muscle aches, many things that I've mentioned here, fatigue, headache, nausea. Those were side effects. Those are typical side effects of the vaccine. And at the beginning of the vaccination process, of course, vaccines were not as secure as they are today. For example, some physicians use arm-to-arm vaccination with the same needle. Can you imagine that? Today, when you get a vaccine, you are shown the needle that is brand new, and this after that that is disposed. But at the time that the first vaccines were were developed, the physicians used the same instrument to vaccinate a whole line of people. So, of course, that was not very wise, and that prompted side effects, undesirable side effects. And well, thanks to that, there's a lot of attention put by developers of vaccines so that they produce better vaccines, safer vaccines, and well, that's the story. Now, anti-vaxxers claim that the governments try to force people to get vaccines, and that in a way say anti-vaxxers limit freedoms, individual freedoms. So many people say, I have the right not to get vaccination, and the government is interfering with my right not to get vaccination. And that has also prompted conspiracy theories and stuff like that. I'm sure you all know that. Now, there's been a lot of polls around the world asking people the following question. If a vaccine against COVID-19 were available this year, would you get it? So surprisingly, many people say they won't. In Mexico City, there was a poll and 60% of the population say, no, I won't get it. Despite Mexico City being very, very, very hard hit by the disease at this time. Now, we have a poll from the Pew Research Center in the US, which surveyed more than 10,000 US adults from September 8 to September 13. And about half, that is 51%, say they would definitely or probably get a COVID-19 vaccine if it were available today. Well, that's a good number. However, the same Pew Center conducted the same poll in May, and it was 72% of people who say they would get the vaccine. So we can see that now we have less people willing to get the vaccine. Why is that? Well, there are many explanations. Some say this is attributable to concerns about the vaccine approval process. More than 3/4 of respondents say they think it's very or somewhat likely that a vaccine will be approved before its safety and effectiveness are fully understood. And 78% said their greatest concern was that the approval process will move too quickly. This is very interesting. That's why we have a turtle here asking, what's the rush? In addition, 76% said concern about side effects is a major reason they would not get the vaccine, while 72% cited uncertainty about effectiveness. So these are very important concerns. Now, as I mentioned at the beginning of my presentation, the process to get a vaccine takes a lot of time. Traditional timeline can go from 10 to 15 years. Well, you have an exploratory stage, a preclinical stage, and then the clinical trials, phase 1, phase 2, phase 3. We have been told that several laboratories, pharmaceutical companies, and government have passed all the process and are currently on phase 3. And apart from that, they will need to wait for approval by proper authorities. In this case, it is because this chart is released by GAO, and it is mentioned specifically the Food and Drug Administration of the US. That is the entity that needs to approve for the releasing of the vaccine or the drug that is intended to fight diseases. And then comes the manufacturing process as well. But as you can see, it takes a lot of time. So many people wonder when Donald Trump, for instance, says that the US is going to have a vaccine by the end of this year. Many people ask, and it is a fair question, if this is a reliable vaccine. Many people ask the same about the vaccines released by Russia. You know that Russia has already released a couple of vaccines, and many people ask if these vaccines are safe for people. Now, how many vaccines are being tested? A number of vaccines. We have 154, around 154 in preclinical trials, and around 11 on phase 3 that involves wider testing and effectiveness assess. And it seems that the Russian vaccines that were released by the Vladimir Putin government were under phase 2. They haven't gone through phase 3, but because of the urgency to have a treatment, a vaccine against the virus, they were produced without going into stage 3. So that's what's been mentioning about the Russian vaccine. Now, let me show you a couple of world maps to tell you a bit about the anti-vaxxers movement. There's a number of people all over the world that believe that vaccines are safe, but there's also people believing that vaccines are risky. So in this chart, you can see countries that disagree with the statement that vaccines are safe. Russia is one of them, and France. Let me show you the next slide, because we have some figures here. In Russia, 23.6% of the population believe that vaccines are not safe. But look at France. In France, 1 out of 3 people believe vaccines are not safe. Switzerland, where you have the headquarters of the World Health Organization, 1 out of 5 people believe vaccines are not safe. So what's happening there? And we also have some developing countries, but there's a lot of concern about the mistrust on vaccines, because that is going to interfere with the possibility of, using vaccination as a way of fighting coronavirus when the vaccines are available. Now, speaking about anti-vaxxers, well, who would be a typical anti-vaxxer? Normally, we have identified some characteristics. Normally, it would be someone looking for notoriety, right? Someone who mistrusts the authorities, people who are suspicious of the government planning to do something terrible to the society, or someone who gets information from unreliable sources. But mostly, since people fear what they don't understand, a common tactic used by anti-vaccine proponents is to just list ingredients and let fears do the rest. So that explains a bit why is the anti-vaxxers movement has been gaining a momentum. But of course, also this has to do with health literacy. Health literacy has become very prominent in the world because, as I'm sure you all know, we are pursuing the development goals for 2030, sustainable development goals, and health is one of the critical issues that we intend to sort out. Health literacy involves a number of things that a person, a society must know about health. Here you can see a woman asking several questions related to health literacy. She asks how to maintain a care plan, what to eat, do I need a mammogram in the case of women, but also in the case of men? Should I vaccinate? What amount of exercise should I carry out? Which preventive health services are the ones I should go through? How to follow medical instructions? When to see a doctor? What are my treatment options? So people need to make a lot of decisions when it comes to health, which is why health literacy is important. So health literacy enables people to develop the skills and confidence to make informed decisions about their health and the health of their families, to be active partners in their care, to effectively navigate healthcare systems, and to advocate effectively to their political leaders and policymakers. And there is a Shanghai Declaration of 2016 that recognizes health literacy as one of the pillars for achieving, as I mentioned before, the Sustainable Development Goals targets. And it is important in this respect that actors on political, community, and organizational levels work together to integrate health literacy as a cornerstone of all national health agendas. Now, believe me when I tell you that health literacy is an issue for developing countries, for low and middle income countries, but it's also an issue in highly developed economies, okay? Don't believe, don't think that this is a matter only for developing countries. It is of critical importance in developed countries, as we have seen in the previous maps that I showed you, with France having a third of its population denying the relevance of vaccination. Now, I want to finish my presentation by providing some final thoughts. We have many companies, we can see them in this slide, working on the COVID-19 vaccine. The companies that you can see here are in phase 3 trials: Pfizer, Moderna, AstraZeneca, Johnson&Johnson. And well, this suggests they may have enough data to know whether their vaccines are safe and effective by October. Well, October is almost done, it's almost gone. Or November, let's wait and see. But even if the health authorities approve a vaccine or issue the emergency use authorization before the end of the year, most experts agree that any COVID-19 vaccine won't be widely available until the middle of next year. And if you saw the debate between Joe Biden and Donald Trump, there's a lot of talk now about having a vaccine until 2022. So this may take a while. And remember, the process needs to go step by step in order to have a safe vaccine. Initial doses will be in short supply, and early distribution will be focused on healthcare personnel, first responders, and those at increased risk of infection and severe illness, such as elderly populations. Countries like Russia and China, who support universal access to COVID-19 vaccination, cannot guarantee equitable distribution either. Distribution is a key issue at this point, because there's a risk that many peoples are left behind. So a strategy for vaccination is needed. And well, we have here a chart showing the types of vaccines that are being developed. AstraZeneca, for instance, is working on a viral vector. Novavax, AdaptVac is working on a subunit. Sinovac, Sinopharm are working on an inactivated vaccine, based vaccine. And Codagenics, Indian Immunologicals, are working on a live attenuated virus version for the vaccine. And Moderna is working on a DNA and RNA model for the vaccine. So there are different approaches to get the vaccine, but we should be discussing at this point what vaccination strategy should be developed. There is something called ring vaccination as opposed to mass vaccination. And we have had the experience of the smallpox vaccination campaign developed during the Cold War, where the World Health Organization played a major role in convincing all countries to work against universal vaccination. The initial efforts pointed to achieve 80% vaccine coverage in each country, but that was difficult to attain in many underdeveloped countries. And a very interesting approach was developed in Nigeria, where doctors develop a strategy of aggressive case finding, followed by vaccination of all known and possible contacts to seal off the outbreak from the rest of the population. That's called That's called ring vaccination. It's been widely discussed because it doesn't imply that every human being in a country gets a vaccine, but only a primary vaccination ring that involves a limited amount of people. Nigeria experience proved successful, even though the population coverage of the vaccine was less than 50%. So there's a lot of debate about that. The other thing I would like to mention is that while we wait for vaccines, there is a number of treatments that are effective in fighting the virus. Donald Trump got the virus, as you know, and the drug used to heal him was remdesivir. Remdesivir has been proved as a very effective treatment for people who get the virus. The problem is that remdesivir is extremely expensive. It's not available for people with low incomes or people who are unemployed and unfortunately get the virus. I was checking the cost for remdesivir in the States. That cost us around $3,120 US for those who own a private insurance, and $2,340 US for others. So I believe this is very expensive. It's not available for everyone, and this is of critical importance. Mexico last April sponsored an initiative of the United Nations General Assembly. There was a resolution that was approved by 179 nations, and this resolution was about international cooperation to fighting the virus. And the idea is that no one holds the vaccines or the treatments available for its own benefit, but that cooperation prevails so that everyone can access treatments, vaccines, and medications to fight the disease. But of course, this resolution, although it was praised by most countries in the world, is very difficult to become a reality for political reasons, for economic reasons, as we know. So the other thing I would like to say is that vaccination is important, but it's a small part of public health policies, meaning a comprehensive strategy approach is needed to prevent new outbreaks from creating a disastrous scenario as the one we have today. So don't forget that once a potentially deadly disease is under control, it loses its terror and people forget about it. So this is important. The fight against diseases must happen every day. No truce ever. You need to work against diseases always, every day. And the 21st century has witnessed so far 2 pandemics. There will be more, okay? We know about the first pandemic that hit hard Mexico back in 2009, the H1N1 influenza. Now we have the second pandemic, the SARS-CoV-2, the Covid-19 from 2019 on, and more are on their way. The world must learn fast, very fast from these experiences. Infectious diseases are not only spreading faster, they appear to be emerging more quickly than ever before. The World Health Organization states that since the 70s, newly emerging diseases have been identified at an unprecedented rate of 1 or more per year. There are now nearly 40 diseases that were unknown a generation ago. And currently, new diseases are favored by changes in the food industry, consumption of meat. Don't you like this cartoon? I love this cartoon. Well, consumption of meat, mad cow disease, cysticercosis, and other diseases. Remember, 70% or more of new diseases are zoonotic. Also, other elements that contribute to new diseases are human conduct and demographics, war and famine, climate change. Many diseases are related to climate change, changes in the medical industry, trade and travel. We are in a globalized world. It is very easy that disease that is developing in one country rapidly spreads throughout the world. COVID-19 is a very good example of that. There are also changes in the agriculture sector, changes in the use of land, and urbanization. The more urbanized the world becomes, the more the environment is affected, and that is also implying a number of potential problems for health in the world. So please try to get reliable information from reliable sources. And it is very important to work on health literacy. As I mentioned, it's not only a matter for underdeveloped economies, it's a matter for everyone. And I thank you for your attention, and I'm looking forward to your reactions and comments.
Excellent. Thank you. Thank you very much, Cristina. What a fantastic presentation, and so beautifully and cheerfully illustrated despite the macabre nature of the topic. I'm going to just ask the audience, and now you can turn your camera on and only use your microphone if you are going to ask a question, and you may do so directly or through the chat. Rodrigo, would you like to comment first, please?
No, yeah, absolutely. I completely agree with your point of view, Ana Elena. This was a fantastic presentation by Professor Rosas. I mean, for me, the main takeaway is twofold. Firstly, you know, the importance of political will as a driving factor for, you know, the innovation leading to a vaccine, or those medical innovations that actually help navigate or actually overcome a pandemic or an epidemic event. And secondly, the importance of international cooperation. So my question, I guess, would be, how do you perceive, what's your take on the interplay between those two sides of the coins, as it were?
Thank you, Rodrigo, for the question that happens to be very important. Between political will and international cooperation, I would say we are in a very critical moment, because many people expected cooperation from all major players in the medical sector. That involves the US. And the US has renounced during the Trump administration to lead the world in the fight against coronavirus. Donald Trump dismissed the relevance of the disease. Donald Trump has withdrawn the US from World Health Organization at the very time of the pandemic was happening, and has, you know, hampered the possibility of reaching a political consensus with key allies and China and Russia and other prominent actors to fight the virus. The US now is having a hard time in dealing with the virus. The US president himself got the virus, which proves a lot of things, that his approach is not good. And I believe that we have to wait for the elections next week. I believe that if the Democrats win, and Joe Biden has been very clear about that, the US may return to the World Health Organization and maybe working together with other nations to fight the virus. We need the US. Why? Because the US has medical expertise, has laboratories, a pharmaceutical sector that is of critical relevance worldwide. So if the US is not involved in these international cooperation efforts, we are losing a lot of input to fight the virus. So political will is critical, but the US has withdrawn from that at this time. Let's hope that changes in the weeks to come. But I would praise the efforts developed, for instance, for Mexico, because Mexico not only pushed for this resolution on April 20 at the UN, which is of enormous importance, but also Mexico has been pushing for cooperation with Argentina and has invited Carlos Slim, this billionaire, to work together with AstraZeneca so that access to the vaccine developed by AstraZeneca and the Oxford University is available for Latin America. So that's what we need. We need cooperation to guarantee that we have access, because one of the critical issues about COVID is not only COVID itself, but accessing treatments and vaccines. That's the issue. As I mentioned before, there's a number of illnesses that exist in the world. There are some treatments, but treatments are not democratized. They are not available for everyone. So that's terrible. Many people have to live with terrible diseases because they cannot afford a treatment or a vaccine. We have to avoid that. We need to work together so that we guarantee that everyone gets a vaccine. I remember the UN Secretary General Antonio Guterres saying at the beginning of the 75th General Assembly that no one is safe until everyone is safe. And he was referring to the fact that we need access all to vaccines and treatments against COVID.
And Cristina, why is remdesivir so expensive? Does it have some kind of really rare ingredient, or is it a secret chemical formula, or a combination of?
Well, you know, this is always the issue when you have a treatment against a disease. And this may change in the future, but I remember when AIDS became a major issue, treatments were so costly that eventually India decided to produce a generic version of the Pfizer treatment against AIDS. And that created a lot of turmoil at the World Trade Organization, because Pfizer and other pharmaceutical companies claim they invested a lot of money to develop the cocktail for AIDS. And India developed it by using the same formula. India is, the world pharmaceutical company. It's almost a pharmaceutical company, India itself, but it was able to produce it at a more affordable cost. So I think that it's going to happen with remdesivir. The thing about remdesivir is that it has proven effective. It's very effective to fight the coronavirus. There are other treatments, but they are as expensive or even more expensive than remdesivir. So I imagine at some point there will be a lot of pressure for the company that is developing this treatment, so that version, probably a generic version, I don't know if India is going to make it, probably yes, is available for people who don't have the resources. But it is very unfair. I believe that in the States, they claim they have the most expensive drug in the world for a certain type of cancer. I was checking the other day, they have a treatment that costs $500,000. It is the most expensive treatment for a certain type of cancer. And of course, that is not affordable for anyone. So we must work on that. The US government has been highly criticized for not working with the pharmaceutical industry to diminish the costs of treatments, drugs and vaccines and such. And both Trump and Biden have promised to work more with companies, but let's wait and see. I don't know. There's a lot of political pressure coming from the American society and also the rest of the world, so that we can access cheaper treatments. Affordable, not cheaper, affordable.
Yeah. And I was also fascinated by the concept of health literacy, which if we compare the way we live with the way human beings used to live, we have become increasingly more literate. However, I agree, we are at a point where there is this infodemic, and our resources have reached a kind of limit. I mean, our rational resources, and we may be vulnerable to believing things that are not true very easily. But if you get the I'm going to use a bad word, the authoritarian imposition of certain healthy habits, it may not work. It may be counterproductive, because then you say, you are attempting against my personal liberties and all that, no?
Yes, I believe health literacy can be worked through both ways, from top to down and from down to top. That way, medical initiatives may be better accepted by societies, because if they know more and they understand the relevance of treatments and vaccines and how to eat nutritious food and such, of course, that will improve the quality of life. But that needs to be worked not only from top to down, but also from down to top.
Do you think we can learn to live in a way that we do not propagate illnesses without feeling isolated or without missing human contact? I mean, is there hope for humanity? Do you think that we can manage to distance ourselves for a while, or not?
Well, when you take a look at the history of illnesses, for example, smallpox, it's a very good example. Social distancing was a key issue when smallpox decimated the populations of hundreds of millions of peoples throughout history. But we learned to live with it. Yes, many people died, of course, but we learned to live with it. And I believe the fact that smallpox was eradicated is because it's been with us for a long time. And many of the things that Edward Jenner did were somehow done before him, probably not as, with the scientific method as such, but variolization was used in China many centuries ago and in other societies. But I believe there's hope, of course. The one thing that surprises me is to see the speed at which we are working to produce a vaccine. As I mentioned before, it may take even 10, 15, 20 years. I don't know if we can wait for so long, because we already are witnessing the economic effects and the cultural effects, the psychological effects of isolation. And this is not good for societies. But I believe we must be respectful of the others. If we don't have a reliable treatment or a vaccine at this time, we should try to be empathic and use, a face mask and stay at home if possible. And if it's not possible, to be empathic and to behave in a way that doesn't hurt others. I'm very sad to see the impact on the health sector this pandemic is having. I'm talking about physicians and nurses. They are the first line of defense against the virus, and they are highly exposed to the virus. And in Mexico and the UK, we have seen they have the highest rates of people that have died in the health sector because they are so vulnerable to the illness. So we need to be more empathic, and we need to, because I believe that this isolation is leading us to be more selfish. And we as communities, we cannot be that selfish. We need really to think about the community, and we need to be more empathic.
Before we open the floor to the audience, members of the audience, I just would like to point out that regarding that health literacy that Ana Elena was highlighting, For me, a fascinating, a very thought-provoking aspect of that concept is, and I'm paraphrasing what you mentioned, Christina, that it is perhaps a pathway to sustainability. And I would say that it works the other way around as well. I mean, and vice versa, sustainability can be a pathway to health literacy. Some authors have argued that COVID-19 might be the disease of the Anthropocene, in the sense that our unsustainable model of production has led us to actually the overexploitation of the resources, which in turn has caused the emergence of these diseases. So I just wanted to point that out and see what are your views on that.
I'm very happy to see Richard Maudsley here, the president of the British Mexican Society. Would you like to make a comment, Richard?
Yes, Maria Cristina, many thanks for a very interesting talk. The speed at which these vaccines are being developed at the moment is quite extraordinary, and it's something that we've never seen in the world before. Are you optimistic that this may change the way vaccines are developed for other problems? Do you think that there is a chance that the companies will have learned how to do this and therefore will do it more quickly? Or has this only happened because there's been such tremendous government pressure and government financing? And so will it be a one-off?
Thank you. Thank you for the question, Richard. I try to be optimistic, but as I mentioned during the talk, there is a number of neglected diseases that have been with us for a long time and nobody pays attention to them. I believe COVID-19 has gained a momentum because it's a brand new disease for which we don't have antibodies and we cannot face it safely at this point, which is why pharmaceutical companies and several governments are getting involved in the production of vaccines. We have not seen that, as you mentioned correctly. We haven't seen that before. I would like to think that this effort, this unprecedented effort, is replicated to fight AIDS, to fight Ebola, to fight chikungunya, to fight Chagas. I would like to see that, but I'm not optimistic, because if you think about in terms of market access, the market for a COVID vaccine is enormous, and the economic interests involved are, enormous. Of course, the Nobel Prize is involved, prestigious. The prestigious of somebody developing the vaccine is involved, but at the end, I don't see that companies will replicate the effort to fight Chagas disease, for instance. So it's pretty sad in a way.
Are there any other questions or comments? Okay. If not, I think it's time. People are very, very grateful for your talk, and especially the Center for Mexican Studies. We are so proud to present a speaker, a researcher, a professor such as yourself, Cristina. Thank you very much for being with us tonight, and enjoy your evening, your afternoon. Bye-bye.
Thank you. Bye-bye.